Okay, so let's talk about medication administration. It's a pretty big deal, right? I mean, we're putting substances into people's bodies, so we need to get it right. Now, there are a bunch of different ways to do this, and we're going to cover 6 of the main ones today. First up, we have intravenous or IV administration. This is where we go straight into the bloodstream, which means it works really fast. But because it's so direct, we've got to be extra careful. Think about it. Hygiene is absolutely critical. Wash those hands thoroughly every single time. And then it's all about finding a good vein, getting that catheter in just right, and making sure the medication flows at the correct rate. You know, it's a bit of a delicate procedure, but with practice, you'll get the hang of it. Then there's intramuscular, or IM, injections. Now, this is where we're going into the muscle tissue. Common spots are your deltoid, thigh, or gluteal area. The key here is to make sure you're in the muscle and not a blood vessel, so we always aspirate, which means pulling back a bit on the syringe. And for some medications, we use the Z-track method, which helps keep the medication where it's supposed to be. It's all about getting the right needle length and angle and being smooth and steady. Subcutaneous, or SC, injections are next. This is just under the skin, like for insulin. We usually use the abdomen or thigh, and we pinch up a fold of skin to make sure we're getting into the right layer. You need to be careful with the angle of the needle and remember to rotate sites to prevent any lumps. Now, we all know about oral, or PO, administration. Pills, liquids, you name it. It seems simple, but there's more to it than just handing over a pill. Patient identification is crucial. You have to double and triple check everything. And then, make sure they're sitting upright and have enough water to swallow. It's about being thorough. Rectal administration might sound a bit different, but it's important. Sometimes, people can't take medication orally, so this is a good alternative. Patient comfort is paramount here. You need to explain the procedure, use plenty of lubrication, and make sure they're in a comfortable position. And finally, we have inhalation. Inhalers and nebulizers deliver medication straight to the lungs, but they're only effective if the patient knows how to use them properly. That's where patient education comes in. You need to show them how to use the device, how to coordinate their breathing, and how to hold their breath. Look, medication administration is a fundamental skill. It's about precision, care, and always following the orders. And remember, practice makes perfect. So keep learning, keep practicing, and if you have any questions, drop them in the comments. And of course, don't forget to like and share. Thanks for watching. In the next lesson, we will learn about point-of-care testing, like blood glucose level, urine, ketone monitoring, and electrolytes, etc., so stay tuned.